Welcome to the Novartis Scientific Exchange. The Novartis Scientific Exchange program advocates both patient-centric and science-based solutions. The healthcare burden is becoming unsustainable. The world is aging, acute diseases are growing, and the most tellingly chronic and often lifestyle-related medical conditions, many of which are multifactorial, are exploding, such as diabetes, hypertension, and Alzheimer's disease. The need for the development of new science-based treatment and healthcare solutions continues to grow. The Novartis Scientific Exchange program also presents the concept that every patient is unique. Healthcare delivery is fast becoming integrated, adapted, and modified around individual needs in a health-aware, e-mobile world. Diagnosis, treatment, and care plans need to be personalized. The patient's family and caregivers should be informed and involved on prescribed pharmacologic and supportive options. For instance, small changes in HbA1c in diabetes or millimeters in mercury in hypertension can lower mortality risk from cardiovascular diseases. The program seeks to present new approaches to early detection, accurate diagnosis and treatment of clinical disorders with patients as partners in health decision-making. Healthcare providers and Novartis Healthcare play a shared role in addressing the alarming rise of chronic diseases through scientific exchange to relieve the immense human and financial costs of these diseases and transform the quality of lives of millions. The healthcare burden is truly becoming unsustainable. By 2020, it is estimated that 1 out of 5 will be over 65. 70% of developed countries will have more people over 50 years old than under 50. Over 200 million people, or 65% in places like China, Asia, and the Pacific, will have more people 65 years old and above. In the country, the National Statistics Office data shows that 8.7 million Filipino elderly are beyond 60 years old. These require healthcare systems better adapted to meeting the needs of the elderly. 3 out of 5 will die from chronic diseases. 10% of individuals beyond 65 years old and 40% beyond 85 years old will have dementia. Global data shows that there are 50 million Alzheimer's patients. 7% of the world's adult population has diabetes mellitus. These require more emphasis on the risk reduction and effective management of chronic diseases. In 2013, 6 out of 100 Filipinos were diagnosed with diabetes mellitus, which translates to 54 million Filipino adults. Around 54,000 deaths are related to diabetes, making it the 9th leading cause of mortality in the country. 1 out of 4 Filipino patients are hypertensive. These point to the need to address increasing comorbidities such as cardiovascular diseases, hypertension, and diabetes. These also require meaningful ways to contain healthcare costs and ensure affordable, acceptable, available, and accessible healthcare funding and services for all citizens of the Philippines.